Hello everyone, and welcome to our live broadcast today. It is Monday, it is March 30th, and we were doing some of these, a live video last week on Instagram, and we are also going to try this today. We're going to do this today on Facebook, and I really appreciate everyone watching us today. And we'll take just a few seconds for everyone to join us today. We should have a really good discussion today, talking about rhinoplasty, or in other words, the nose job. And first of all, I hope everyone is doing okay at home. I know it's been several weeks now. We've been kind of sequestered, or we've been sequestered. I know that's a lot on everyone, and the reason why we're doing these is to be able to come to y'all, be able to talk about some of these things that we really don't get to share on a normal everyday basis. Typically, I'm having these discussions in the office with folks, but this is a really great way to communicate with you. And I hope everyone is able to learn something from this today. So what we're going to do is we're going to talk a little bit, or we're going to use this session to talk about the nose job, the rhinoplasty. I'll move the camera back and forth to kind of show you some examples here on the screen, which I just went black there, but we'll get that back here in just a second. What let's do is let's essentially kind of bear with me a little bit with the technology. We're going to go over the procedure itself first, and then we're going to actually go through some cases to show you what we've done and what the outcomes look like as well. Okay, so let's talk first a little bit about the nose. Let's talk about the structure of the nose, what we can do to kind of help correct that. And what I'm going to do is I'm going to bring you forward just a little bit so you can see my screen here. There we go. And so here is just, we're going to use some of these illustrations of the nose. This right here is what we call a typical, they're calling this, an average nose, kind of a normal nose that most folks would like to see. And a few things we're going to talk about here. First of all, let's talk a little bit about the different parts of the nose, okay? This right here, this is the nasal bridge, we call it the dorsum, okay? Typically comes down to about right there. And this is the nasal tip right here, okay? And what the terms we'll use the terms, say, projection. We also use the terms rotation. What those are talking about the nasal tip. So the rotation of the nasal tip is how far this tip turns up or turns down, okay, in relation to the lip right there. And also when we talk about a dorsal hump right here, you can see that right here. She's got a pretty much nice straight dorsal hump from right here at the angle, or we call this the radix, the root of the nose, all the way down to the tip, okay? If we look over here at the frontal view, she's got a nice tip width right there, and it kind of comes down, nice curved line just like that, and nice curved line just like that. So that's what we're looking for when we're doing a rhinoplasty, and we're looking at a nose job. We want these lines to be really nice. We want the dorsum just to be slightly more narrow than the tip. We want a nice, as we call, kind of equilateral triangle right there at the base, and we like to see some symmetry of those nostrils there. So let's take a look at some things that we see quite often in our office. Folks come in and they say, this is what's bothering about my nose. So this example right here is what we call a dorsal hump, okay? So this is where there's a little bit of a bump on the bridge. We can see that there. You can see here on the frontal view, hopefully you can see that on the frontal view, that we have, let me get you just a little closer. Don't worry, I'll turn you back here. There we go. So you can see here on the screen that this is a little wider than our tip. Okay, the nasal bone's a little wider. We don't have that nice line like we were talking about just a second there, and also possibly we could have just a little bit more of a wide tip right there. So that's something that we hear quite often from our patients is I don't like this hump on my nose. So here we're talking about a bulbous tip. Okay, so really we're paying attention right here. We hear this quite a bit. Folks don't like the width in the nasal tip right here. They wish for that to be thinned out as well. And you can also see here we've got a little bit that kind of adds to the dorsum, okay, or to the nasal bridge, kind of makes that a little higher than we want. And you can also see down here in the base view that we have a little bit more width in our base view. We don't have a very nice equilateral triangle that we're looking for. Okay, so that's another, and a lot of the times those are in combination. Someone says I've got a dorsal hump. Someone says I've got a wide bulbous tip. Hey Christine, there's Christine is signed on. Our wonderful nurse injector is saying hello to us. I'll ask any questions as I go through this, and we'll talk about some cases. Other things that folks ask. Here's a wide nostril example. Okay, so this patient's nostrils are a little more wide, a little more flared than they would like, but their dorsum, their nasal tip looks okay. So that's something that we see quite a bit. And also, remember how we were talking about rotation? So this is someone whose nostrils or whose nasal tip is turned up more than they would like. So you can see right here. Folks can have never had surgery before. Some folks actually they can see that after they've had a surgery before, so we're actually correcting that. Okay, so those are kind of the main issues that we see quite a bit. Let's talk about how we access the nose and how we do these operations. So in my practice, we perform mostly what we call a open rhinoplasty. What that means, this is where we're going to make an incision in the nose. We make an incision right here, and I've put it here on the screen so you can see we call it a V, or an inverted V incision, goes right there. And then we also make incisions on the inside of the nose as well to help access the inside of the nose. We then reflect the skin, the covering of the nose, and we're able to make the changes on the inside. Okay, those incisions really heal impeccably, especially when you put them together really well, which we do. And so let's talk a little bit about how we actually perform the rhinoplasty. I'm going to grab my pen so I can kind of show you what's going on. So let's see here. So when folks come in and they're asking, sorry, let me back up just a little bit. Let's talk about how the nose is made. This is a great illustration so y'all can see exactly what makes up the nose. So the nose is made out of both bone and cartilage. Typically we say the upper third from here up is made of bone. The lower third from here down is made of cartilage, so you can see that right here. Upper third is bone, lower 2/3, I may have said 1/3, sorry. Lower 2/3 is cartilage, okay? And we make changes to these structures to help us achieve the results that you're looking for. So let's draw on this just a little bit, and let's talk about the dorsum first. So someone comes in and they says, I really don't like this dorsal hump that I have on my nose. How are you going to correct that? Well, typically what we do is we actually will remove some tissue, both from the bone and from the cartilage. So from the bone up here, okay, and then we can also take some from the cartilage if we need down there. Okay, see I'm kind of drawing that in red. So all of this can be reduced during surgery, okay? What we're doing is we want to make sure we have it, depending on what the patient's looking for. If the patient's looking for a nice straight dorsum, straight down, we can do that. Some folks want a little bit of a swoop from the root of the nose. We call it the radix down to the tip. We want a little swoop. We can do that as well. Really, that's the reason why it's so important. We have a really nice discussion in the office about what it is you're looking for. We'll use your photos, we'll morph them to kind of help that as well. Okay, so that's how we do that. All right, If y'all have any questions or need me to go back, y'all just ask. We can do that. So let's go back and then let's talk about some other things. So I'm going to move over here so you can see this picture right here. Let's talk about this. So this all right here is cartilage. This is all cartilage as well. Okay, structures of the nose. So let's talk about the nasal tip. Okay, folks ask me a lot, how do you actually take the nasal tip, make it smaller, make it more refined, which is a very good question. And a lot of folks say you just go in and just shave things down and make it a little more narrow. That's partially true, okay? So I'm going to show you right here, these are the lower lateral cartilages, all right? And what we do is when we get to the tip, we actually take some of the cartilage off, okay? So we go right there, and we go and we take a little bit right there, okay? And that's what we call a cephalic trim. I'm using some big surgery words, okay? But essentially, when we take that little bit of cartilage off, that helps to thin the nose. It also helps to bring the tip of the nose up just a little bit, okay? And then, so that's one of the things that we're going to do. Then typically the other thing we'll do is we're actually going to put some little stitches, some sutures right there and right there, okay? So I'm going to put show you that's little green stitches right there and right there. Then we're also going to put a little stitch right there. Y'all may not be able to see that very well. No, you can't. But what I'm trying to show you is those stitches that go right there in the tip. And what I do a lot of times for my patients is I kind of use my hands. So the analogy is the tent and the tent poles, okay? So the cartilages, as you see right there, okay, I'm going to try to do them like this with my wrist here, okay? In a wide bulbous nose, things are kind of flat, okay? And when the tent is pulled over these tent poles, you see kind of this wide, flat area, okay? When I put a stitch right here, right through this, we call that the dome right there, and I tighten that stitch, notice how I start to sharpen, okay? I start to sharpen the tip just like that, okay? I haven't removed any tissue, but I make it from this wide area to this very nice, sharp, narrow area, okay? So now when we pull the tent over these tent poles, okay, you're gonna see a nice, sharp, or a little more definition there, okay? Then what we do is we take the two domes and we suture them together like that. Do you see how we're even getting more definition when we do that, okay? And that also helps when we have a cleft, a little cleft in the nose. I don't know if I've got one. Got a little bit of cleft. When we pull those together, it's much sharper as well. So when we pull the skin over, you're going to see that. You're going to see it going to be a lot sharper, not as bulbous. And that's how we do the tip, okay? Some other things, a lot of things that folks will ask about is how do you correct the septum? So some folks say, I have some difficulty breathing, and out of the right side, out of the left side. The other thing is, and a lot of folks have questions about what the septum is. Right here is a diagrammatic representation of what the septum is. Okay, it's a piece of cartilage that sits right here in between on the inside of the nose, and it's the reason why I can't stick my finger from this side to the other side, okay? So the other thing we'll do during this procedure is we can take sometimes, if we need some cartilage, to put some grafts in the nose during the procedure. Again, a little bit more advanced surgery. We won't cover that today. But what we can do is we can harvest some of that cartilage. Let me show you here, just like this. And we can take a little section out, just like that, okay? You can see how I've kind of marked that, see here, right there. We can take a little piece out, okay? And I said we weren't going to cover it. The reason why we would ever use some of that cartilage is if you have difficulty breathing on one side versus the other, we can put that little cartilage right here in the middle vault. We can put it there. We can put a little piece of cartilage underneath this cartilage there, or underneath that one right there to give some support. We can put it on top to help camouflage some little divots. There's a lot of things that we can do with that, and we can harvest that from the septum just like that, okay? So hopefully I'm answering some of the big questions that we get, and if y'all have any questions, please ask. rhinoplasty we do through an incision right there. We lift the skin, we access the bone and cartilage, we make those changes, that's kind of in general, that we set up there. And then once we're done, we reflect the skin back and we put tiny little stitches right there. That heals up beautifully. The other part of a rhinoplasty, or the other type of rhinoplasty, is what we call a closed rhinoplasty, where we don't actually make an incision right there, okay? A closed rhinoplasty, if we have some minor to not so major changes that need to be made, okay? If we just need to remove a little bit of the dorsal hump, if there's just a little nasal bone, or if we just need to make a little change to the nasal tip, we actually just make some incisions right on the inside of the nose there and access it that way. It's a little bit more limited access than we have with an open rhinoplasty. So that's the reason why a lot of times I will favor the open method. That's nothing that you as the patient have to worry about. Come in, discuss this with your surgeon, and he or she will go over all those options and what can be done with you. Okay, if we don't have any questions about kind of the technique, what we're going to do now is let's go over some cases. Let's see how we're doing. We're doing great on time. So we're going to go over some cases. Let me turn my TV off. So all of the cases I'm going to show you today are patients that we've done, and they're patients that we certainly have their permission to use their photographs. I've kind of, they are not, let's see here, let me mirror my screen back. I've tried to, though, just for these purposes, hide their identity just a little bit. We're just going to focus on the nose. But I think we're going to still learn a lot. It's better to see the whole face, eyes and the chin, but we're going to learn a lot even doing this as well. And then come in and we'll kind of go over some of these photographs as well. So let's go over this first case right here. So this is a nice young lady, came in for complaints, several complaints. She did not like the crookedness of her nose. Okay, so this is kind of deviated over here to the right, as you can see, or excuse me, over to, yes, her right. And it's in a C-shaped form, okay? So she has both, she's got some deviation both of her bone and of the cartilage. She didn't like how her nasal tip was a little wide. And you'll see in just a second, she also did not like a little dorsal nasal hump. So what we did is we performed an open rhinoplasty, did those techniques we just talked about earlier, okay? And let's take a look here. Let's take a look at the front. So hopefully you can see here, she's deviated to the right in this one, but now she's looking pretty straight there, okay? Notice kind of the width, the lobosity of the nasal tip right there. We've narrowed that down really well as well, okay, using those cartilage sutures like we discussed. Also, let's take a look. She has a little bit of a dorsal hump right there, which we took down, gave her a nice little swoop, and just refined the tip. We really didn't change her rotation. If you look at her nostrils, it's about the same as that, but we brought the nasal tip up, made it look a little bit more refined, a little more sharp. She was very happy. Let's go. Here's another view of that. You can see dorsal hump, no dorsal hump there. She's very happy with that as well. Okay, let's go to the second case here. Okay, once again, kind of very similar to what we saw before, just a different patient, so you can get another idea. Crooked nose here to the patient's left, C-shaped, wide nasal tip. Okay, here I'm kind of also showing you, she also did not like this dorsal hump there, and did not like how her nasal tip was kind of being pushed down by that nasal dorsum. Okay, so we took her to the operating room today. Open rhinoplasty, okay? Hopefully you can notice here she's got that C-shaped. Now we're nice and straight. We have kind of this wide nasal tip here that we've now brought that in, made it much more refined, okay? So let's take a look here. So this is something else that I really like, is that dorsal hump there now is a nice swoop from the root of the nose down, comes down to that nice tip. We also gave her just a little bit more rotation and really refined her nasal tip as well. She was very, very happy with that. And there's what we call our 3/4 view, which is really important. 3/4 view really kind of shows you what the dorsal hump looks like there, okay? Moving along, so let's go to a male, okay? So here's a nice, very nice gentleman, had some deviation of his nose here to the right, also wide nasal tip right there. The other thing he did not like was his dorsal hump and how far his nose sat from his face. So again, what we call projection, okay? Felt that he was over projected there and too much of this dorsal nasal hump, okay? So we performed an open septal rhinoplasty. Let's take a look at what we did. So hopefully you can see immediately he's deviated there. There he's nice and straight. Had width of this nasal tip right in there and of the dorsum, brought it in right there. Okay, so really kind of refined things. Also gave him just a little bit more rotation of the tip right there. Not too much, never over rotated. Okay, let's take a look here. So hopefully you can see here, we have really reduced the dorsal nasal hump. We've also brought the tip of the nose back towards the face just a little bit and gave him a little bit of rotation. So he was very happy with that. We can also take a look here on our 3/4 view. Okay. Things are nice and straight. We don't have that dorsal hump. Okay, we're going to do a few more here. Nice young lady. She has a little bit of a deviation of the dorsum here to the left. Also, the nasal tip is kind of pointing down just a little bit. She did not like that. Also, once again, did not like her nasal dorsum set too high and the nasal tip sat too far out from her face and was pointing down a little bit. Okay. So let's see what we did there. All right. So hopefully you can notice we kind of straightened things out there and brought her nasal tip up just a little bit. Okay, not too much. And here, let me show you. Let's see here. We brought that dorsum down and also brought her nasal tip up and made it a little more refined there. Okay, so we increased the rotation of the nasal tip. Looks very, very nice. It's not too much, very subtle, and also refine that tip. We can also see what we did here on the 3/4 view. Again, I know we're not showing the whole face, but hopefully you can notice the really nice dorsal aesthetic line, really nice nasal tip. She was very happy. Hang with me just a few more. We're going to take a look at a few more, and I appreciate you all hanging with me. Here is a nice young lady, had some pretty significant deviation of the nose here to the left side of her face. She did not like that. Again, did not like the dorsal hump as well. So we did an open rhinoplasty. Hopefully you can see pretty immediately that we're deviated here to the left. Now everything is really nice and straight. We also refined this tip, brought this up just a little bit, brought everything in line. She's very happy with that. Here, so this time we didn't really do much of a swoop of the nose. We brought down the dorsal hump and increased the rotation of the nasal tip right there. Have a nice smooth nasal dorsum right there, and here's our 3/4 view. So you can see this nice straight dorsum as we're there. We had a dorsal hump. So again, she was very happy with that. And let's move on. Okay, so this is another important one. This is something that we see quite a bit. So this is where we're going to bring what's called the septal deviation. Okay, so this nice young lady, one of her complaints was she didn't like the width of her tip there, but also, what else can you see very clearly? Right here, okay, she has what we call a septal deflection. So this little piece of cartilage is swung over into her right nostril. She didn't like that and wanted that to be corrected. Also, that was causing her some breathing difficulties. Again, this is just another view of the front. She didn't like the width here or there. So we performed an open septal rhinoplasty, okay? And hopefully this is coming out on y'all's screen, that how much we were able to, again, see that nice dorsal aesthetic line from the root of the nose all the way down. We're able to thin out the tip and in there in the dorsum over to here, okay? Also brought a little bit of that hump down. Not too much change there. but we were able to make that look a lot nicer. And the one thing that we were looking at earlier, so I want you to notice here, the septum is now no longer here, it's now swung into the midline. We also have some really nice definition of the nasal tip. It's not quite as bulbous as it was there. You can also notice, let's really kind of zoom in. Let's take a look at that incision line. So there, you're looking right there at her incision line, okay? So when you put it together really nicely, it really heals imperceptibly. You should not be able to see that at all. Okay, one more and I think we're done. Kind of on the same theme, this patient did not like her dorsal nasal hump. Right there, also wanted a little bit of rotation to her nasal tip. Here's a view from the front as well, just for comparison. So let's take a look there. So this nice young lady, she had dorsal hump, which we took down, really nice dorsal aesthetic there. Also refined this tip, gave it just a few degrees of rotation. Not too much, never over rotated, just a few degrees of rotation. Let's take a look at it from the front. Also was able to bring the nasal tip up there, kind of thin things out, make it really nice and straight. She was really very happy with that. And here is our 3/4 view. I love this 3/4 view. Really just nice, beautiful, straight nasal tip. And that's it. So hopefully this has been what I hope everyone is seeing with the rhinoplasty, or what we really want to talk about today, is our job as surgeons, as plastic surgeons, as facial plastic surgeons, is to bring you in and to, Christine's asking a question, and we'll get to that, but really to help refine the nose. That's what I say a lot, is where we are refining, making a natural and refined look, okay? So we don't want you to be afraid that we're going to make you look done. We want everyone who has a rhinoplasty to go back out and no one to be really able to tell that you had it done. Had a patient right before Thanksgiving, and it was about 2 weeks before Thanksgiving. I said, I want you to take a poll at the Thanksgiving table and see how many folks you think notice that you've had a rhinoplasty performed. And she said, I don't think anyone will. And I said, I don't think anyone will either. And she had a pretty significant change to the nose that we made. And as a matter of fact, no one did notice that when she came back in for follow-up. So that's really our goal. Christine is asking, what do we think about other procedures performed along with rhinoplasty? We love other procedures and love to do other procedures in combination with the rhinoplasty. So what are those? Well, a lot of times we can also augment the chin. Okay, we can put a chin implant along with the rhinoplasty, which works beautifully. So the whole purpose of the rhinoplasty is to help bring the face into balance, help balance the nose with the eyes and with the chin. Sometimes we need a little more definition of the chin, and that procedure, we will go over that a little bit more detail later. But the short version is we make a small incision right there underneath the chin, place a chin implant in through that incision, okay? And the whole point is to bring the chin out, just give more balance. It's not to overdo, it's not to give yourself a big or a large chin by any means. What do we use for chin implants? We use, there's one type, it's made out of what we call silastic or silicone. Works very well. Also Gore-Tex, there's a Gore-Tex mesh that we can actually customize. We roll that into a nice little roll. We can customize the size and we can put that in. There are lots of different options for that. Those are typically fairly straightforward procedures. We do it at the same time as the nose. The recovery is just rolled into your rhinoplasty recovery. Should not add any more. We also have done rhinoplasty with facial rejuvenation procedures. So facelifts, lower facelifts, neck lifts. We can do those together beautifully. We've done upper lid, lower lid surgery with that as well. And that works really well as well too. In addition to fat injection, a lot of different fat injection is wonderful to do along with rhinoplasty. So there are lots of different options we can do during the time or along with your rhinoplasty when we have you under anesthesia. Let's talk about that. So typically rhinoplasty is done under a general anesthetic. It's a very light general anesthetic. And once you're asleep, again, my analogy is you're in the swimming pool, okay, which is general anesthesia, but really you're only sitting on that first step in the swimming pool. You're not that deep, okay? So we have you nice and asleep and comfortable. Then I'll inject some local or some numbing medicine into the nose while you're asleep, okay? And so that's how the procedure is performed. It's really done under local. Typically the procedure takes anywhere from 2 hours, sometimes 3, even sometimes 4, depending on how complex it is. There's just small changes, usually doesn't take that long. You're able to wake up, you'll go home the same day. When you wake up, you'll have a white cast here, small stitches there. Sometimes I will place 2 stents, not packs, but stents on each side of the nose. And those come out, those come out really beautifully. The typical recovery time for the rhinoplasty is usually, as I say, best case scenario is 1 week, worst case scenario is 2 weeks, but we rarely have anyone who takes 2 weeks to recover from this procedure. So we see a lot of folks, they're back from fall break, Christmas break, they want to get this done, get back to school, or someone who's got a week of vacation at work, they want to get this done, get back to work. And that's really our goal to be able to do this procedure safely, get this done safely, and get you back out doing what you like to do. So let's see here. I'm just checking. Yep, that's wonderful. That's about the time that we've had. Any other questions? Please, everyone, send those in to us as well, and we're going to go over that. We can go over those certainly as a future date or on a future date. We've been doing these throughout the week. Kind of select a topic, and if you have a topic you want to hear us talk about, please write in, and we'll go over that on our subsequent Facebook Live and on our Insta Live broadcasts. So I really appreciate y'all taking some time to join us today. Hopefully you learned something about the rhinoplasty. I hope everyone is staying safe and not getting too much cabin fever during the quarantine. Okay, we will talk with y'all soon. Thanks.